Okay, so focusing on the human sexual response and coitus, some unique things about human sexual behavior and sexual contact is, yes, some of the things you guys mentioned. Forward-facing coitus, multiple positions, not always rear-mounted, right? Like in other mammals, that's the way to say it. Like in other mammals. See, I have to correct you guys on language too.
Yeah,
see?
thank you.
Okay.
I
All right.
appreciate it.
Okay. So not always in that sort of traditional way in the animal kingdom or in mammals, but some of the other higher primates, like great apes that are closely, actually bonobos, did you guys know, are the closest genetically related to us? It's like 99 point something percent genes in common or identical. And they occasionally will do similar little behaviors. Yes? Are we good? Okay. Okay. It's okay? You're good? Okay, okay. So they will do similar behaviors, a little bit of forward facing occasionally, but that's rare. Okay, so humans are unique. There's some elements. What else? Not just positions of forward facing, but
care for your partner.
Care for the partner. Okay, so that compassion, that empathy, connectedness. Yes.
The ability to kiss during
Kissing. That's it. Okay, kissing, the foreplay kissing stuff. You will never see lions. I mean, they lick and bite occasionally, but you will not see actual kissing and foreplay. We're going to add, yes, Tatiana.
communication.
Communication. Key. Bless you. Bless you. Okay. Alec. Emotion. Expressing emotion. Even that sign of like intimacy and connecting. Yes, right? It's hard to measure some of these human considered characteristics because there's a lot of other animals that share some of the emotions that we have. Like we talked a little bit about elephants, right? Did I mention elephants have a lot of care and compassion and stuff? So it's hard to measure some of these things. But physically wise, we know that these are the catalog of sort of characteristics and things that humans have that set us apart. So occasionally we'll see it in some of the great apes. Sexual arousal. In general, this is when the environmental factors or internal thoughts initiate some sort of sexual response, or the beginning of a sexual response, okay? So this arousal, as we'll see, fits into the human sexual response in the excitement phase of that cycle, okay? So usually that has to happen in order for everything to progress, okay? If it's sort of a normal setting. Erotic stimuli, those are things that are sexually arousing, and there's a lot of variability. So there's a ton of variability. I realize I'm going to have lots of images in here that are going to be appealing or not to different people, but just showing there's a wide range of things that individuals will find erotic or arousing or appealing, right? Some people even would, like body hair, not like body hair, like different parts of the body, different sensations. They're going to vary a lot among different individuals. Cultural influence and variation in those arousing stimuli is going to be there. There's going to be variation based on cultural influence, societal influences based on where you live, and then based on your own personal preferences that come from a combination of factors, right? So in the US, we have stereotypes of sexually attracted male and female that are perpetuated in mainstream media, right? So we have these sort of images. You guys, we get bombarded by, I don't even know who I chose here, Justin Timberlake, I really like him. And then Mila Kunis, I really like her too. So those two, I think they were just in a movie together. They're not really together. They're just, so these are sort of models. They're people that are perpetuates the idea of what's sexually attractive and what's appealing. Gets perpetuated in the media and movies, mainstream stuff, social media, all of that, okay? Sexual arousal by sight of the breast. I jumped ahead. Okay, you might think, well, seeing breasts or boobs, right? Those are erotic stimuli. But actually, in some countries, they're not. It's not even a big deal. It's like, whatever. It's just part of the body. It's just the anatomy, right? Looking at male and female, that's an anatomical difference. So not in all cultures, but here in the United States, yes, that is a factor. And it can be considered sort of an erotic stimuli or an arousing factor for some people. And I think part of that also has to do with your dress, right? Your physical appearance and what you cover, what we in different societies cover up. The things that are showing versus not showing, those have a factor, right? Shoulders, yes, some places like to show arms and shoulders or even legs, like if you're wearing shorts, like we wear shorts here, that is considered like, ooh, that's a arousing part of the female body. You got to cover that up. I traveled to Europe. I gave a talk at a big reproductive conference there, and I was going into the different mosques. And in the summertime, I wear not very much, right? I'm wearing shorts and a tank top, and I got my hoodie. I couldn't even enter the mosque. I had to put on the wrap over my head and cover my shoulders. It was mainly making sure my shoulders, like you said, the shoulders and the arms were covered, so they couldn't be bare. So that really has a lot of geographical, cultural differences And what a society goes, ooh, that's sexy, or that's arousing, or that is not, okay? In general, in our society in the US, it's considered sort of thinner is sexier than heavier, just in general, right? So this is something that's sort of been perpetuated and considered sort of in the media and society as sort of a norm of accepted, something that's sexy. But I will say there's a lot more, you guys have probably noticed, a lot more emphasis on different body types and beauty in all different forms. And if you look at ads and social media, there's things like the Dove campaign, are you guys familiar with that, right? Like all body types and sizes and individuals. And even if you go to Target now, I don't know if you guys noticed Target, they have a similar series of ads where the women are in all different shapes and sizes. Like if you look at the big giant border posters on the wall in the ads, the women are not tiny little women. So every time I see that, I'm like, God, this is good. They're like different sizes and different shapes. Not just the marketing and the clothing, but the ads, the women that are on the different ads. So that is actually changing even more than it was just 10 years ago. So is there universal sexual attractiveness? I'm going to ask, a lot of these I'm going to pose questions and we're going to kind of talk about it. Universal means that if I go anywhere around the world, I could ask, this woman or this man or this person, is this attractive? Do you find this attractive or is this unattractive? And would I get a census? Would I get a lot of people agreeing, yep, this is good, nah, not so good? Is there universal sexual attractiveness where someone is sort of, it induces a sexual response or excitement? Alex?
Well, okay, I heard that like the more symmetrical your face is, then like the more attractive you are, but then I also heard that that was linked to photography and like how a camera would pick up your face, but I don't know.
Being photogenic is part of that. I think being photogenic and knowing how to sort of angles and the way the camera picks it up, that is a factor of whether you consider something, oh, that aesthetically looks pleasing. But the first thing you said actually hits it right on, symmetry. And there's a lot of symmetry analyzers, and I don't recommend doing this. There's a lot of apps, okay, and I did it, and it's not fun, because you're right, it depends on the photo. So if I am dead on, right, and so you have a nice symmetrical view, bilateral, we have a right and left half. Did you know that not everybody, the right and left half is almost never exactly the same. So our symmetry is not a 10. Like we wouldn't say your ratio is a perfect 10. Between the eyes, right, from eyes to forehead to nose to lips to across, like we can measure all those different anatomical features, and they basically come from your bones and your muscles shaping your face. Almost nobody is a perfect symmetry there. But if you do one of those little symmetry apps, depending on the photo or the angle, you'll get like a 4 or a 9. Like there's too much variability. A lot of it is sort of angles in that respect. But there is true symmetry to a face, and we can analyze it, right? We can do it in lots of different forms. So I will say that's one type of beauty that we would say someone is aesthetically attractive. That doesn't necessarily mean sexually attractive, that you would be sexually attracted to that person because of the symmetry of their face. But it is universally sort of considered a feature of something that's attractive or aesthetically pleasing to look at. Does that make sense? Okay, so symmetry we're going to come back to later because that actually is a factor. Yeah, Lex.
For women, are you seen as more attractive if your hips are wider because it's associated with like childbearing hips?
You guys are too good. Okay, but all these, we're going to come back to these. Okay, so symmetry, it's actually called waist to hip ratio, and I made you all measure it. Remember that? Okay. That has to do also with perceived attractiveness or beauty, sort of what looks physically attractive. And that does link in, yes. So by the eye, people won't even, they think, a lot of people, and this is going to sound weird, I know, people say they like a big butt, or they like breasts, or they like none, or they like small built, or big. Almost for all sort of women and men when they get polled, their eye doesn't really, what they notice is the sort of in and out structure. So the waist and the hips, regardless of size, that ratio holds up pretty universally. And then for looking at a male build, it's the shoulder to waist ratio. A lot of women say it's height. Height is also a factor. But
What is shoulder to waist?
shoulder to waist. Okay, so it's the triangle. Do you guys know the triangle, right? So the shoulder to waist and the hip to waist to hip ratio, those are two features that people will find attractive. Okay, and those link into sexual attractiveness, and we're going to talk about chemistry and attraction a little bit more later. Universal features of sexual attractiveness across all cultures. Really, it's a youthful appearance in females.
Barf.
This sucks.
Barf.
It sucks from my perspective. But it's skin, hair, smile or teeth, eyes, and hips. So hips come into that, and that's the waist to hip ratio. That we'll expand on a little bit more later. So that really, like, youthful appearance is something that's found sexually attractive. Symmetrical facial features in both sexes, and you already hit that exactly. Many studies on this looking at beauty or symmetry tests, symmetry analyzers that actually find that sort of universally people will rate somebody more attractive. She actually has a 10.
So does Bella Hadid.
She's a 10. And who else?
Bella Hadid. They did the golden ratio on.
Oh,
the
yeah,
faces.
yeah, yeah.
She
Right.
scored higher than Beyonce.
Yeah.
What the heck?
And Beyonce, I was going to say. Oh, but see, there's a lot of personal preference. See, so it's not just symmetry. It's not just symmetry. There's a lot of personal preference because it's the eyes, it's the shape of the lips, it's the, nose, different structures that people like. Those are different and they're kind of personal preferential type things. But overall symmetry just goes, okay, if you get a series of faces and one is more symmetrical, more people are going to rate that as a beautiful or an attractive image aesthetically or person aesthetically. Yes? Beyonce is another one that's very high up too. Angelina Jolie, Beyonce. There's several of these. They have very, very good symmetry. Okay? And there's also, as you've already said, I think Lex said this, waist to hip ratio. Okay? And so really it's a smaller somewhat waist to hip ratio. It's not so much size overall, but it's proportions with respect to the waist and the hips. Does that make sense? So it's that hourglass, sort of. It's that sort of hourglass. And as I think you also said the same thing, hips have to do with childbearing, right? So if you have hips, more than likely a baby's head is going to be able to fit through the birth canal and come out. Right? And that's a factor of it. It is, because there's hips, yeah, males are much leaner. We know this, right? Because in lab we did the waist-hip ratio, and I think Mike was like, why, is mine supposed to be like this? Because I had the female, I'm sorry, that was gender bias right there. I had it sort of focused for the females. I had the standardized chart, and he wasn't really even on that. He's like, mine's way higher. So the waist and the hips on a man are much more similarly proportionate. And on a female, the hips are bigger. They go out, right? And that happens at puberty, and so we have that. Some people are a little hippier or curvier than others, but females have a lower waist-hip ratio than males in general. Were you going to add to that, Bobby?
I just want to ask a question.
Yeah.
People who prefer, like males, are they also looking for the,
You mean like if a female's looking at a male face, symmetry?
I mean, a person, yeah.
Or any person?
Yeah.
Any person. Any person. Symmetry actually, and there's a lot of studies looking at this, symmetry implies something, for some reason, in all of our brains about health. That's one of the theories. About good health, well-proportioned, genetically, everything should be, right, everything is sort of symmetrically portioned. So it might give some sort of subconscious cues about sort of health and reproductive fitness and, status. Balance, yeah. So there's no sort of misproportion. Everything is proportioned fine. I honestly don't know why. But people see it and they go, oh, I like that more than that. So yeah, I don't want to spend too long on this. We are going to talk more about this when we talk about the chemistry of attraction and we talk about physical features. Shoulder to waist ratio, you guys we mentioned that as well. Shoulder to waist ratio and height. So those when looking at like men, those are the features that people notice. Did you want to add to that? I feel like
Chris Evans, if you do
He's-
if you look up Captain Dorito, there's a picture of him with a Dorito on his back.
he's a triangle.
It's a literal triangle.
It's a triangle. So a lot of people find that very appealing. So the man, they go big shoulders, small waist. Yes.
Are they like a 10 because of plastic surgery or like?
Yes.
Yeah.
Absolutely.
Except Beyonce. Except Beyonce.
I don't want to.
Well, I don't want to get into them debating cosmetic surgery.
Well, it's
But
like,
Angelina Jolie, I've seen her even when she was really, really young. She just has a very symmetrically portioned. She's got huge zygomatic arch. That's cheekbone. Angelina Jolie. Big lips, kind of a lost square set jaw. She's got very prominent features. I don't think she's altered a whole lot. She did have a double mastectomy as a preventative for breast cancer, had both of her breasts removed and then augmented. Face, I don't think she's done anything to her face. I'm not a cosmetic surgeon expert, but I've seen her over time and sort of looked at their faces over time, and even Beyonce when she was younger. I think they always look like that. So some people have much more symmetry than others. That's it. Some are just more symmetrical. That's what it comes down to. All right, what are erotic stimuli? Honestly, I know I'm glad you guys like to talk about that because we've got a whole lecture. We're going to focus on all that stuff like chemistry and why you like what you like. But we got to get into the actual sex. Okay, that's the point here. All right. So the stimuli perceived by our senses, the erotic stimuli, the things you pick up, we use vision, hearing, touch, smell. I say or taste, but you can use all of those. Those are pretty much your special senses, and then adding touch into there. Tactile sense is actually not one of your 5 special senses. A lot of people, even biologists, will say, oh, touch is it's not a special sense though. Special senses are confined to the head. They give critical information about the world around you. So that's vision, hearing, smell, taste, and balance, believe it or not, vestibular sense, your sense of balance. But I add touch to this because that is a critical element to excitement or erotic stimuli. So touch is a factor. All right, visual stimuli are primary for most, especially for men. Okay, so visual stimuli is something that's a big component to this arousal or excitement phase here. Pornographic industry is huge. Okay, that tells you right there. It's huge. Good. Okay, so there's some correlations. Yeah, Michael, want to add to that?
The taste.
Yes.
I'm confused on how is that a erotic stimuli?
Well,
Just-
I guess we're going there now. Okay. This is another one that I'm not going to put on YouTube. I have a feeling.
No, put it on.
No,
Okay,
we're
well-
talking about, like,
Yeah, okay.
sexual appearance-wise.
Okay, so sexual appearance, what you are physically attracted to based on appearance,
Also, like, actually
vision.
sexually. Gotcha. Okay.
Okay, so we're talking about
Take it back.
sex. Do it make sense?
I get it.
All right, so taste. Well, I'm gonna give you like the PG part of that. It's like if you kiss, you're actually tasting that other person, right? In some ways, or you put their lips on their body. You're actually getting chemical signals and chemicals and information in that. That is a part of taste and smell. That's all part of taste and smell. Does that make sense? Okay, let's just hang tight for a second. Okay, pornographic industry is huge. What does that mean? Visually, stimuli is big for many, many people. And we could say, look at gender lines and secondly, who's kind of doing what. But in general, it's huge. And a lot of people do it. It's a giant industry. I mean, I think Pornhub, there's this funny Facebook thing, how long it took for these things to get like 1 million viewers. Pornhub took like less than 24 hours. Facebook took like 2 years. Okay, so if you look at the build or the progression of these different things, that is huge. I will also say the cosmetics industry is huge. Okay, so I'm going to give like all sides of all these different things. The cosmetic industry, and that is to add to the face, accentuate, add to make bigger eyelash. I love the bigger eyelashes. Like I love them. I'm always jealous. I do that. I do the lash extensions because then I don't have to do the mascara and stuff. But then they fall off and they look all crazy. And I had like 4, and they're like, and I'm like, oh, it's too. And then I end up like ripping them out. Like no, but I think it looks pretty. I think it like exaggerates the eyes. I like it. So, and a lot of other individuals think it looks nice too. Like they go, oh, I like your eyes. Your eyes stand out. They pop. Like okay, so that's visual. All those things are visual aesthetics. You're like, wow, that looks nice to me. Touch, tactile stimuli, I would actually argue is as important, if not more important than visual stimuli. Are we good? Yes? Okay, all right. And now I just want to keep touch base on with everybody, make sure everybody's good. All right, touch, tactile stimuli, this is actually necessary for most. Okay, so vision, tactile, touch, very important. So that is a huge element to excitement, to arousal. Smell? Smell important? So I'll pose that right now. I mean, not like stinky smell, I mean smell.
I mean, if someone smells bad, that would be a turn off.
All right, so if someone smells bad, oh, hell no. Okay.
She smells good.
She smells good.
She was smelling my armpit. I'm sorry.
You do, you smell good. You're the one that wears the perfume that I need to get.
That's so sweet.
Okay, so we're some of the poorest smelling mammals. Our sense of smell is shitty, quite honestly, right? It's not good. Dogs can smell 100, 1,000 times more and further away and pick up odorant molecules that are airborne than we can. But I would argue that actually smell is pretty important. Smell is very important. We're going to come back to chemistry and attraction and the potential of pheromones and chemical signals that have effects on the brain. And we'll see there that actually smell is a really important role. It plays an important role. So smell, chemical signals, pheromones may greatly affect our sexual biology, so arouse and attract us. And you all know, when someone smells good, or you like the way someone smells, even if they're not wearing, and I don't like all the chemical stuff, to be honest. I don't like a lot of heavy perfumes. That's why it's surprising I like yours so much. I don't like a lot of cologne. I don't like a lot of perfume. I don't even like a lot of lotions. Like some of my friends, they look so pretty and they're so put together and they have all this perfume on. I'm like, oh my God. I'm too sensitive to that. But when you smell someone's like natural smell and they don't have anything on, you're like, ooh, you smell good. What are you wearing? They're like, nothing. I'm like, wow. Exactly. And I would argue that this actually is not just sexual attraction between, either same-sex or opposite-sex individuals or different people, but it also communicates like among friends and among people that like each other and kind of line up in different ways. You don't realize it, but there's unperceived and non-smelling signaling chemicals that are communicating between people. I know you all have met an individual. Maybe you didn't end up in any kind of romantic relationship with them, but you knew right away, like, I like this person. I like them. I really don't know them. It's not even how they look. It's just something about this person. Like, I met one of my closest friends here at St. Mary's, a colleague. And right when I met her, I just heard like 3 words out of her mouth. Barely even know. She said a couple of things. She said something funny. I thought, oh, she's quirky. I just thought, we're going to be friends. Like, I could bet. If I had to bet, I was like, we're going to be friends. And then I started talking. And she was like, girl, where are you? Where did you come from? What department are you from? Like, we just linked up. It was like 2 peas in a pod. And we're still like best friends to this day. And it's more than just someone's personality or their physical appearance or their... I like that she like cussed and stuff, so there was that element there. I was like, oh, unfiltered, yes. So that's how I started to know I'm gonna line up with people. But this is very important, and I know you all know if you've been in a group of girls or women and you start cycling on the same cycle. We talked about menstrual cycle and cycling. That is coming through chemical pheromones. It's called the dormitory effect. Those are imperceptible chemicals that are going up through your nose and in your brain, and then cyclizing the women on the same exact menstrual cycle. So that's where I'm going to kind of leave it for now. We'll come back to that later. But we are in tune with the chemicals of other people, right? And so that's part of our erotic sort of stimuli. That actually factors in. And especially if someone is not the smell that you like you'll notice that, right? You'll go, ooh, yeah, no. Ooh. No, you can't help it. You're like, it's like wired. Okay, so we'll come back to that. And I will add, so as I'm talking about these things and how we know they're important for human beings, especially here in the U.S. and in Europe, perfume cologne industry is huge. Huge. So if smell isn't important, then that would not be a $1 trillion industry. That would not, right? So smell and visual and tactile, all these things are important. All right, so now we get to the erogenous zones of this human sexual response. The erogenous zones, these are sensitive to tactile stimuli of different types. Females, in general, it's the glans clitoris, the mons, the labia minora, the lower 1/3 of the vagina. So I had you learn the human reproductive anatomy, right? Remember? We'll do a recap on that in a second.
Yes.
Okay, so you should know where these things are. Yeah, you should know what they look like, where they are. Males, it's the glans penis, okay, which is the end, right, not the shaft. The corona, the lower side of the penile shaft. For both sexes, in general, it's the nipples, the lips, the tongue, the earlobes, the anus, the buttocks, the inner thighs, and even the back of the knees, the soles of the feet, the center of the back. These are common erogenous zones. Now let me say, this is not the same in all people, right? Some people hate the bottoms of their feet touched. Like you touch the bottom of the feet, they go, they'll kick you in the face.
I will.
Right? I have, and my son too. If I'm like, he's like, he'll kill me. So this is in general, right? In general, we know based on sort of studies of testing these that these are the most common areas. These are considered sort of the erogenous zones among males, females, both sexes. All right, so recap on human anatomy. Remember the shaft of the penis, the glans penis, the corona, the ridge that goes around, the external urethral orifice, the testes in the scrotum. Here's the testis, here's the epididymis. Vas deferens. Actually, I think I had a diagram almost just like this on the exam.
Yeah, and I didn't do well.
Yeah, and I didn't do well.
I didn't
A
spell
lot of you guys did good on the female. That was
I
good.
did good on
You
that
need
one.
to, you need to buff up your male anatomy, reproductive anatomy a little bit. Prostate, vocal urethral glands, ejaculatory duct, and then vas deferens where it goes out. Urethra, sorry, vas deferens and then urethra. Okay, so that's a little recap. Female anatomy, I have this exact diagram on the exam. The mons pubis, or the pubis mons, labia majora, labia minora, prepuce or clitoral hood, clitoris.
I didn't get that one.
Yes!
Yes.
Okay, clitoris, and then external urethral orifice, okay? Vaginal introitus, if you said opening of the vagina, that's fine. Greater vestibular gland openings, lesser vestibular gland openings, they make fluid, okay, they make little secretions. And then the hymen, the edge of the vaginal introitus opening, labia minora, anus. Okay, so I had 7 on each label. They gave 1 point for all of those, so you'll get those back. I may not give the exams back Friday. We might do that Monday.
You know, how
Is
about
that-
we just not?
How about we just
Probably just all get an A.
Okay, so now we're gonna just compare. A lot of people don't do this. A lot of people don't do this. And actually, I would say even in high school and earlier sex ed type things, they always go into STDs and contraceptives, and they don't really talk about gender, about sexuality, about reproductive anatomy, about. And you guys probably aren't even aware, like, the structure of the clitoris. You're probably, you just see a little part that sticks out. That's all underneath. So this right here sticks out. That is all built into the internal reproductive anatomy. It is homologous, actually, in the body, the erectile tissue of it, and in the overall structure to the penis. So a lot of people don't realize this. You think it's just a little tiny nub, but there it is. That's all you can see. So I would say that size and variation of the human clitoris is much larger than originally thought. There's even researchers in the last 6-7 years that are studying clitoral size and structure and shape, and it varies among women. There's a lot of variation anatomically among women. Only glans clitoris is visible, so the glans clitoris is right here, like the glans penis. Only that is visible. And this is it's the tip of the iceberg, really, because that's the only part you can see. All the rest is kind of underneath and buried. Okay? The shaft or the body is deep within the tissue. It can be 1.5 centimeters or longer, okay, depending. And there's a lot of variation. It can even be longer than that, 3 centimeters, which is over an inch in length, okay? Shaft has corpora cavernosa, spongy cylinders of tissue that fill with blood. Now remember the erectile tissue of the penis. We talked about that. We looked at it in lab under the scope and the model. The corpora cavernosa is sinus cavities that can actually get congested and fill up with blood. So that causes engorgement of the tissue.
Keep going.
Okay, engorgement of the tissue. So the clitoris actually can fill with blood and fluid and get sort of engorged in shape and size. Okay, and that same thing happens in the corpus cavernosa of the penis, of the shaft of the penis. So it truly is homologous. So there's structures there. There is also sensory receptors. I should get a good diagram of that. Sensory receptors that perceive tactile touch information. Tons of them, thousands that are located. Actually, as human beings, in the genitals, specifically the penis and the clitoris, and the hands and the fingers, and the lips and the tongue and the face. Those are the most highly dense areas of sensory receptors. That means we are tactile, sensitive in those specific regions of the body. Okay. Some of these things I think in this lecture will probably surprise you quite a bit. A lot of people do not know about some of these things. Yes, Alex?
Does like the size of like the whole clitoris affect the orgasm? Like, is there studies on that? Or is it
Well, there are a few studies on that. I'm not too well versed on all of them. Yes, there is size, and they've even studied the glans clitoris, the size of the actual glands, the part that actually we can see that protrudes, and then the body and the crust, the two sort of legs that are embedded, sort of the crust. We'll get it. We'll look at that. So if we look at the crust, here's like that, the legs that go down here. This is actually called the pubis bone. Okay, pubic symphysis right here. The mons pubis would sit right on top there. That's where the skin and the tissue is right here. The pubis bones are here. They're glued together with fibrous tissue. It's called the pubic symphysis. This is wider in females than it is in males. Males goes like this. Females go like that. So the crust, the two legs, if you will, the clitoris, are sort of embedded right up against the pubis bones. And then the prepuce, the clitoral hood, covers all of that. So there are studies looking at that and looking at some women are a little bit more tactile sensitive. due to the size and the amount of the clitoris that's actually exposed. Because it's covered, right? It's like the prepuce or the clitoral hood is kind of covering most of that. So access to that and size can make a difference, right? And there's a lot of variability. I don't know the specifics of some of the recent studies, but there is some correlations and there's a lot of variability in different people. All right, proceptive behavior. Okay, so that was probably everything. Well, actually, we could talk more about the clitoris. We're going to come back to that later because we'll talk about the third cycle of the human response, sexual cycle, and we'll get back to that. Proceptive behavior, what is that? What is proceptive? External or like accepting, proceptive, like you're open to, okay, I like this, I'm gonna go in this direction. In general, proceptive behavior is flirting. This comes in lots of different forms. Some are weird. You know, I watch people, I like watching people. I'll go out, like be hanging out with friends. I'll watch people interacting. It's very interesting to me, right? Courtship behaviors, seduction type behaviors, trying to like seduce somebody else and get them to like you. Foreplay. Proceptive behavior indicates that you like that person. You are attracted to that person. They are sexually arousing to you in some way, okay? Culture and tradition affect proceptive behaviors, okay? So indicating that you like that individual and you would like to pursue things further. Universal proceptive behaviors, are there proceptive behaviors that indicate that you would like to sexually engage or you're sexually attracted to an individual? Are there universal ones?
We learned in a sense and perception class that the more times you say someone's name to them, the more likely they are to like you back. Like when you're talking to them,
Yeah.
if you say their name.
Right. That's really interesting. That is, I've seen studies on that too. And I think that a lot of people do like that. They respond well to that. And I think even Alex, you brought that up last time. You said the way when you hear your name, you like that. That's like a euphoric, right? And so, and I have the same experience, right, in different settings. And I think when you meet people, it's also a good way of remembering their name by saying their name multiple times. But a lot of studies have shown that, yes, it gives them a positive sense of well-being and like, oh, this person is engaged. They like me. They're saying my name. But I have to say there's a cultural component to that. Because I have friends that they don't like their name for whatever reason being heard. And in their culture, even the way they refer to each other and their pronouns are different. And they refer to each other more as like they and groups and not as their specific names. They have almost pronouns that go with different individuals and families and in systems. And so they don't use first names or parent given names as much. So we were having a conversation, she said, oh, I don't like it when someone says my name or says my name a lot or, ooh, it's not a turn on at all. And I'm like, really? Wow. It's cultural. So there's some cultural components to that for sure. But I would say here in the U.S. that holds up. Yes, in the U.S. for sure. But I have a lot of friends, like different backgrounds, Asian, Latina, different countries, and that it doesn't always hold up. So universal ones, yes, there are some proceptive universal behaviors. And I'll just go through the ones that we know and that sort of make sense across the world. Eye contact. If you make good eye contact, in general, people like that anyways. Some people do not, if they're a little more introverted or shy or they get uncomfortable with that. But in general, to indicate that you like someone or you're interested, if you make eye contact, that's usually a good thing, right? Although sometimes I will say it's hard to do that, right? If you really like somebody, you're kind of nervous. I'm not, getting kind